I read the papers down here and across the country. It makes it look as if the issue of whether or not we are going to move forward with the implementation of the health care bill passed a few years ago is just about politics. It's just a political football. It's being tossed back and forth between the two sides. And while the threats are really empty, there's no way that we are going to pass a continuing resolution that isn't going to include the funding of this vital healthcare law, it still gets an enormous amount of play out there. And I think it's important for us to come down to the floor and explain to the American people that this issue isn't political, that the healthcare law isn't just a piece of paper. The healthcare law is a lifeline to millions of families out there across America who have been absolutely drowning in healthcare costs and in inability to access the system over the past several decades. We didn't pass this law to score political points. We didn't do it to make ourselves feel good. We did it because we saw just almost immeasurable human suffering out on the streets of America that this place needed to respond to. That it's just not okay that in the most affluent, most powerful country in the world, about 15% of our society has the potential to go to bed sick every night simply because they can't afford to see a doctor. It's certainly not okay that 50% of the bankruptcies in this country historically have been caused by the misfortune of an individual or a family member to get sick. And so I think it's time that when we talk about the implementation of the healthcare law, Obamacare, whatever you want to call it, we are talking about consequences that are not political. They are consequences related to life or death. That is not hyperbole. There are people out there every week dying because they don't have access to our nation's healthcare system, which, if you can find it, is and can be the best healthcare system in the world. The problem is there are far too many people who have no insurance and no way to access it, or who are vastly underinsured and can't get the right access to it. So I just want to take you through for 1 minute what this is going to mean to our constituents, to your neighbors, and what it would mean if by some miracle of politics, the Tea Party gets its way and this bill was no longer the law of the land come next month. Let me tell you what it already means for a senior citizen who's living on $20,000 a year in New Britain, Connecticut. Today, that senior citizen gets to walk into their doctor to get a wellness visit. And they don't have to pay anything out of pocket any longer. Previously, they did, and you'd think that that's not a lot of money, but for somebody in Connecticut who's living on a fixed income, or somebody, Mr. President, in Delaware that's just taking home a pretty meager Social Security check every week, the costs escalate when you're just trying to pay your rent or your mortgage, put food on the table, be able to gas up your car to get back and forth to see your grandkids. That extra expense of having to pay for preventative costs, that can actually make a difference. What makes more of a difference is for those seniors who have pretty high drug costs. One of the worst things this Congress did over the last 10 years was pass a prescription drug bill that had this donut hole sitting in the middle of it, so that if you paid for a bunch of drugs through the Medicare benefit, eventually you'd start having to pay out of your own pocket. That can be thousands of dollars that senior citizens don't have. This health care bill closes the donut hole, eliminates half of it almost overnight, and then essentially eliminates it over time. That's thousands of dollars in savings for seniors. That's medication that, frankly, a lot of seniors would have never been able to buy that they will now be able to access because of this law. Those things go away if Republicans get their way and Obamacare is defunded. All of a sudden, if that happens, tomorrow senior citizens have to pay out of pocket for preventative costs. And seniors who have high drug costs all of a sudden go back to having to pay 100% of the cost of generics versus 50%, which is what they're paying now. That's a real cost. What about the average family of four out there who today in Connecticut is paying about $605 a month for health care? And probably a health care plan that's not even that good to begin with. Probably has some significant holes in it in terms of what it will cover. Well, if this health care bill is implemented, which it will be, that number goes from $605 a month down to $286 a month for the average family of 4 in Connecticut. Let me tell you, the average family of 4 in Connecticut living in Stamford or Bridgeport or Norwalk or Norwich, they could use that extra $300 in savings to help save for college, to help put a little bit more nutritious meal on the table, maybe to pay some back credit card bills. $300 a month is a big deal. That is the difference that this health care bill will make. $605 a month down to $286 a month in Connecticut. Big difference. And an even bigger difference because the health care plan they're going to get for $286 a month is going to be a good one. We're going to finally have some standardization when it comes to the benefits that you're getting so that when you go out there and buy a health care plan in Connecticut or wherever you are, you're going to know what you're getting. There's going to be a minimum set of benefits that are going to be covered. You're going to be able to know that when you buy insurance, you're getting ambulatory patient services, you're getting coverage for hospitalization, you're getting coverage for maternity and newborn care, that your prescription drugs are covered, that you're getting lab services and rehab benefits. Every plan's going to be able to cover these things, but not if the health care bill was magically repealed. All of a sudden, people that were counting on that number coming down from $600 to $300 in Connecticut will be paying $600 and probably $700 and $800, and they will continue to have to deal with a dizzying array of benefit packages, many of which just simply don't measure up to what families need. What about for Betty Berger? What does this mean for her? She's a constituent of mine in Meriden, and she doesn't want anybody to ever have to go what she went through. She and her husband had health care coverage for them and their kids through her husband's plan. Her husband switched jobs, and in the week's time between which he was at his first job and his second job, their son was diagnosed with cancer. Her husband's second job identified it as a pre-existing condition and effectively refused to cover the son. The Bergers lost everything. They lost their house, they lost their car, they lost their savings simply because their son was diagnosed with cancer during the 1 week in which the husband wasn't employed. That will never, ever happen again after this bill is implemented. No insurance plan regulated under this bill can deny a family access for health care simply because one of their family members is sick. It's unconscionable that that ever happened in this country, and it will not happen again if this bill is implemented. But if the Republicans get what they want and this bill is defunded, if this bill is repealed, in that magical fantasy world, the example of the Bergers happens hundreds and thousands of times over across this country. And lastly, what about the McCullough family? Another family in Connecticut. Little Kyle McCullough, when I first met him, he was 8. He's probably 10, 11 years old. He's got a very complicated disease that he has to take $3,000 injections for. He will hit his lifetime limit in a matter of years, and his family will be on the hook for every expense thereafter. The health care bill says no more lifetime limits for health care coverage. If you have health care insurance, it's going to take care of little Kyle McCullough for as long as he needs those injections at whatever cost it's going to be. That's why it's insurance, because for people that get a bad lot in life and have a big, complicated, expensive illness, they're going to be covered. If the health care bill is repealed or defunded or whatever Republicans want to do, Kyle McCullough's family has to pay for that out of pocket for the rest of their life, as will thousands of other families like him. That's what the stakes are, Mr. President. It's not a piece of paper. It's not a political football. It's life and death. It's hundreds, if not thousands of dollars that hardworking families throughout this country desperately need, and a healthcare system that they need to be much more fair and much more compassionate. It's not going to happen. It is political fantasy that Republicans are going to be able to defund or repeal the health care law as a consequence of the budget debates that we're going to have over the next few weeks. But let's be honest about what they are asking. They are asking for higher costs for seniors. They are asking for higher costs for middle-class families. They are asking for more bankruptcies. And they are asking for more misery for the thousands of families who are struggling to keep their head above water when they deal with a complicated illness. That, Mr. President, is the true reality of what's happening out there today in our healthcare system that is getting better by the day and will get better even still if we move forward with the implementation of the healthcare law. I yield the floor and note the absence of quorum.